This section is going to be a little bit longer. I need you to stick with me. We're going to be talking about the muscles that cross the elbow, both anteriorly and posteriorly, as well as the groups of muscles that are going to provide flexion and extension, as well as supination and pronation of the antebrachial region, as well as muscles of the hand and fingers. It's not as bad as it sounds, so just stick with me. We already know that biceps brachii is going to be one of the prime movers of antebrachial flexion. Brachialis is going to work with biceps brachii. Brachioradialis is not only a stabilizer, but also a synergist for that same action. This shows you those muscles as well as deltoid. Remember, the major abductor of the, you got it, upper extremity. Take a look at pec major again, and pec major is going to be responsible for flexion of the upper extremity, as well as adduction and medial or internal rotation of the humerus. You can see just a sliver of triceps brachii. You can see the biceps brachii and brachioradialis. Those guys are going to be the major flexors of the antebrachial region at the elbow. And then we also have brachialis. We've already talked about triceps brachii and anconeus. It's weak synergist. Triceps brachii is the prime mover when it comes to extension of the antebrachial area. And we've seen that, and look at the bottom of the list for anconeus, if you would. So the muscles of the forearm, most of them you need to know as a group. They will act upon the wrist, the fingers, the thumb. They will cause pronation. They will cause supination. Most of the anterior muscles are going to insert by what is known as the flexor retinaculum. We'll take a look at that. And the posterior muscles are going to be extensors and will insert via the extensor retinaculum. So this is what you need to know. The muscles of the anterior antebrachial region are mostly flexors. So if you are standing in anatomical position and you flex your wrist, your hand, and your fingers, those will be found on the anterior aspect of the antebrachial region. When you extend your wrist, your hand, and your fingers, if you're doing the royal wave that Queen Elizabeth and her family do, you're using extensors, and they will be on the posterior aspect of the antebrachial region. So let's take a look. Right, before we go there, you do need to know these three. And fortunately, their names tell you what they do. Pronator teres and pronator quadratus are going to pronate the antebrachial region. Supinator conveniently will supinate the antebrachial region. It works in conjunction with biceps brachii. This is a list of some of the flexors. You do not need to know these muscles specifically. You should be able to tell me, however, what flexor carpi radialis does. It's going to flex your, you got it, arm at the wrist. Same with flexor carpi ulnaris. One will insert on the radius, the other will insert on the ulnar bone. And then we have flexor digitorum superficialis and flexor digitorum profundus. That means you have a superficial muscle that is going to flex your fingers, and you have a deeper muscle that's going to flex your fingers. Flexor pollicis longus is specific for the thumb. Pollicis or pollicus, I don't care how you pronounce it, is associated with the thumb. If you have a longus, you have to have a brevis every time. We do need to talk about the transverse carpal ligament. And there it is. Transverse carpal ligament is implicated in the carpal tunnel because when you have true carpal tunnel syndrome, that is going to impinge upon the median nerve. And yeah, you need to know this for assessment for this module and for the nervous system, because you're seeing this twice. We're talking about the median nerve. So that transverse carpal ligament is going to help stabilize the carpals. There are tendons, blood vessels, and nerves, including the median nerve, which are going to travel through that carpal tunnel. When you have inflammation, the median nerve gets impinged and you have carpal tunnel-like symptoms. The boundaries of the carpal tunnel will be the carpals and the flexor retinaculum, transverse carpal ligament. There are 9 tendons that sit within that tunnel, as well as the median nerve. So there's not a whole heck of a lot of room. So if you have any sort of inflammation or any sort of problems with those tendons, it's the median nerve that is going to get affected, because tendons, you'll remember, are not terribly vascular. They don't have a terribly strong nerve supply. They're not terribly well innervated. So it's the median nerve, which is a much more fragile tissue, that will take the brunt of any sort of inflammation. Back to the flexors, there you have them. The retinaculum is going to be important, not only because it will provide an anchor for muscles, it is also because it is a, what kind of connective tissue? I bet you can tell me. Connective tissue anchor, which actually keeps those tendons flush to the skeletal system, so they're not popping up and potentially getting damaged. You can see down here pronator teres, and you can see here pronator quadratus. Yes, you need to be able to name those, because if you were asked, name muscles that pronate the antebrachial region, you got to tell me pronator quadratus and pronator teres. So you can see pronator quadratus a little bit better. Quadratus because it is kind of four-sided. Here's supinator. You can tell me what that guy's going to do. It's going to supinate the antebrachial region. And this is just giving you an image of the deeper muscles. When you talk about the muscles that are associated with the posterior aspect of the antebrachial region, we are talking about extensors. They will all extend the wrist, the hand, and the fingers. And sure enough, their names tells you that. Abductor pollicis longus. If there's a longus, there's going to be a brevis. There's going to be an abductor of the thumb. But all the others are going to extend either the carpals or the digits. This shows you those muscles. Here's anconeus, which is that weak synergist to triceps brachii. And this is going to show you the deeper muscles. The more superficial ones have been reflected back. You can see supinator, and yes, indeed, that's the one that's going to be supinating the antebrachial region. I bet you can tell me what where interossei are found in between bones. Yes, they are. So I do make you learn extensor indices as well as extensor digiti minimi, just because I find them entertaining. When you stick your index finger up and say, "One moment, please," you are using extensor indices, which is pretty cool. When you stick when you're drinking tea properly, and you have your little pinky finger, digiti minimi, sticking out, that you are engaging extensor digiti minimi. What fun. So the muscles of the hand, the intrinsic muscles of the hand, are really very small, weak muscles, and they are going to lie entirely in between the metacarpals. They are going to allow for very precise control of the movements of both the metacarpals and the digits. So if you're threading a needle or you're doing fine, detailed work, these are the muscles that are going to come into play. They are both abductors and adductors of the fingers. They're one or the other. So they provide abduction or adduction of the fingers. And they will produce opposition, which allows the thumb to move towards not only digiti minimi, the little finger, but all the other fingers too. That shows you opponent's palliasis, which allows for your thumb to touch your digit minimi, your pinky finger. So what are the finger and thumb movements? Flexion, yes. So the thumb will bend medially towards the palm or along the palm. The fingers will bend, flex anteriorly. Extension, the thumb points out laterally, and the fingers will actually move more posteriorly.